Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Congenital malformations. So the first one we'll look at is the posterior malformations. So there is something known as a small posterior fossa. It includes the small posterior fossa. There is herniation of the cerebellar tonsil. Herniation of the cerebellar tonsil. Next comes there is a the peg-like tonsil. This is seen in case of the Arnold-Chiari 1 syndrome. Next is the presence of the meningomyelocele. Meningomyelocele. So meningomyelocele, it is basically associated with the Arnold, and this is the Chiari 2 type. Next we move on to the Chiari 2. The Chiari 2 malformations, this is present on the MRI. Next comes the Arnold-Chiari type 3. So type 3 is which is associated with the encephalocele. This is associated with the encephalocele. Next, there is the syrinx. The syrinx is seen with type 1. Syrinx, this will be seen with type 1. To learn and grow daily like this, please do subscribe.